So now let's get into the tape itself. So the first thing that I want to mention is you can buy pre-cut strips or you can buy the continuous roll. Both are just as effective, both are basically the same thing. It's just the pre-cut can be a little quicker because you're not having to cut it. However, the downside to the pre-cut is it may not be the size that you need. So if you're taping your 14-year-old gymnast daughter on the shoulder, the size of the strip is going to be much smaller compared to a 45-year-old bodybuilder on the shoulder. So those are things to consider. Is the pre-cut is cut and it may save you time, but it may not be cut to the right size. The second thing is measurement. So this really piggybacks off that first point. When you measure an area that you want to tape, you want to actually cut the tape a little bit shorter than the area you're trying to cover, because you're going to add a little bit of stretch to that tape. I don't know of any tapes where we really don't add any stretch. So depending on how much you plan on stretching it, you're going to want to cut it a little bit shorter to account for that stretch. We'll talk a little bit more about stretch in a minute. The other thing is the two basic tape shapes are a Y shape or an I shape. So an I shape is basically the strip itself. Very basic taping can also use a Y shape. There's a million different shapes, by the way, but these are the two most basic and the two that you'll probably use the most. The Y has a line kind of bisecting, I shouldn't say kind of bisecting, but bisecting the I to anywhere from a third of the way down to maybe half the way down to possibly 2/3 if you need it. But it ends up making a Y shape because the bottom remains intact and then you create two little pieces at the top. The fourth thing is you want to trim the corners. Corners tend to fray easily and they fray first. So if you trim the corners, that's going to help your tape stay on a little bit longer. Even when you cut into a Y, you still want to trim all those new corners that you have as a result of cutting the tape. The fifth thing is anchors. So anchors are the ends of where you're adhering your tape, or the starting place of where you're adhering your tape, or the finishing place where you're adhering your tape. I shouldn't say ends because it's not always ends. It's frequently ends, but it's not always the end. You can have a tape that you cut in the middle, and then you use that middle section as your anchor, and then you pull one side, and then you pull the other side, and you've created a middle anchor instead of an anchor just at the ends. These tend to usually be about 1 inch in width for most tapings. You can modify that if you need to. 6, you get one chance per tape. This means you cannot put on a strip of tape and say, oh, I don't like the way this came out, or this is folded, or let me start over, rip it off, and then try to apply that same piece of tape. Once it's touched the skin and you rip it off, that's it. That piece of tape is done. If you try to stick it, you've lost at least 50% of your efficacy and you're not going to have the same results. So it does take practice, but try to get it down the first time so that you're not going through strip after strip of tape. The other thing is, remember, each time you peel this tape off somebody's skin, it's going to irritate the skin a little bit. So you don't want to keep peeling it and peeling it from the same spot as you keep trying to redo it. So practice maybe on yourself, and then as you get better, that's when you tape others, because you really only get one chance with this. The other thing that I would say is when you're sticking the tape on, try not to handle it with your fingertips. You'll notice in the videos that I show you, most of the time, anytime I'm gripping the tape, it still has the paper on it, and I've found a way to tape as I still hold on to the paper, but you'll see that later. So once you've applied the K-tape, you should be instructing people how long to leave it on. What I usually tell people when they ask is, hey, as long as it stays on. What I literally say after I've applied it is, okay, so you're going to leave this on as long as it stays on. For most people, that's about 2 or 3 days. It is a heat-based adhesive, so heat makes it stick more. Because of that, you want to avoid applying any sort of direct heat pack to this. Ice is fine, shower's fine, swimming's fine. You just want to avoid direct heat so it doesn't stick to your skin. The other thing that I tell people is, as it starts to come off, to make it last longer, obviously it's the ends that are kind of peeling back first. You can just trim the ends as they peel back and leave the majority of the tape still on. The other thing that I tell people is, if you hate it, if it's super irritating, if you just don't like it, take it off. But what I recommend is rubbing some sort of oil or lotion on the outside of the tape to kind of loosen it up before you peel it off, because I've seen it time and time again. You know, we apply the tape and then they have a party that night, so then they get home and they peel it off really quickly, and then they have this huge red mark where the tape was, and obviously, you know, it was adhered, it was sticking to the skin. If you peel it off like that the day of, it's gonna probably take that first tiny layer of skin with it and leave you kind of red. So make sure that you're doing this in a safe manner, and you're not and you're taking good care of your skin if you do take it off.